Now let's get more on the COVID situation in Queensland and Victoria and bring in Emilia Terzon in Melbourne and Jessica Randell in Brisbane. Good morning to both you. Emilia, huge lines at testing sites we've been seeing in Victoria, and also Ambulance Victoria briefly declared a code red early this morning. Tell us all about what's been happening here.
Well, it's clear that the healthcare system at the moment in Victoria is battling on so many fronts. As you mentioned, Ambulance Victoria overnight, it declared a very rare code red for several hours, and that meant that it was telling people who were calling 000 and were seeking an ambulance to expect significant delays. It's since dropped that code red, but this comes as COVID cases here rise. Ambulance Victoria says that it's experiencing this demand because people are calling up with mild symptoms, but also because they have staff that are being furloughed at the moment, which is putting increasing stress on the system. Now, as COVID cases rise, we know that we just had 17,000 cases reported in the last 24 hours. We're hearing from other parts of the healthcare system that they are not coping either. We had a major healthcare provider, Western Health, this week say that it wants people to stop going to its emergency departments with mild symptoms or asking for rapid tests because they just can't deal with that sort of demand. And we also know that this comes as PCR testing here in Victoria comes under incredible stress. We've seen those vision this morning of those long lines. We know that 54 testing sites have been closed by private pathology companies this week because they can't keep up anymore with the testing. We also know that around 40 sites that are still open, those ones with those huge lines this morning, they're now at capacity. So as we're hearing from experts, it's likely there's many more cases out there in the community because people just can't get tested at the moment for this virus.